Assalamu alaikum. Assalamu alaikum. My name is Rida Zainab, visiting lecturer, GC University, Faisalabad. In today's lecture, I would like to throw some light on the differential diagnosis of acute renal failure. If a patient comes with a complaint of oliguria or anuria, what would be the associated symptom? On the basis of that, we can diagnose or make a provisional diagnosis of acute renal failure. So, first of all, I would like to explain what is acute renal failure. So, basically, it means loss of renal function developing over days or a few weeks. And in this case, if patient has a chronic renal disease and then develops acute deterioration of renal function, so in this condition, it is called acute on chronic renal failure. Um, First of all, I would like to explain the causes which can cause or lead to the development of acute renal failure. So, uh, s- these are basically the prolonged hypotension, which may be due to the hypovolemia or hemorrhage, vomiting, diarrhea, and burns, and septicemia, cardiogenic shock, hepatorenal syndrome. And these are basically the pre-renal causes which can lead to the and which can cause the acute renal failure. And if we talk about the renal causes of acute renal failure, that are acute tubular necrosis, which may be due to the prolonged hypotension, and and this acute tubular necrosis may be due to the pigments and toxins. uh, Along with that, glomerulonephritis is another cause of the development of acute renal failure, vasculitis, interstitial nephritis. And if we talk about the postrenal causes of acute renal failure, that are basically obstructive uropathy due to the uh, obstruction in the urinary tract. So, if the patient comes with the complaint of oliguria or anuria, oliguria basically means is described as the urine output is less than 300 ml in 24 hours, and anuria means there is no urine output at all. And these so if the patient comes with the complaint of oliguria or anuria, we should necessarily check him for the as there may be back end cause may be and acute renal failure. So we note the following sign and symptom in the patient along with the uh, oliguria or anuria. So the patient may complain about the symptoms and that he or she has a low urine output, which I already described as the oliguria, and there may be puffiness of the face and more marked in the early morning. And so the puffiness of face is another presenting symptom in case of acute renal failure along with oliguria or anuria. And the patient may be breathless, uh, and anorexia, nausea, vomiting also occur as the blood due to the um, raised urea level in the blood, where and patient may become drowsy, unconscious, and may have fits as uremia progresses. So the along with the oliguria and or anuria, these are the symptoms which, if present in a patient, then we can make a provisional diagnosis of acute renal failure. If we note signs for acute renal failure, so they basically include the breathing, and that patients will be acidotic. Acidotic breathing means rapid. It will be rapid and deep breathing, and the face of the patient will be puffy, and pedal edema is may be present, which means the edematous feet, and the signs of heart failure will also be present and these signs of heart failure will not be originated from the cardiac will not be cardiac originated, uh, uh, but these are due to the fluid overload. as fluid overload generate due to the oligouria and anuria due to the low or zero output of the urine, and pericardial rub may be audible due to uremic pericarditis, as uremia cause the inflammation of the pericardium, so the pericardial rub is audible in patients of acute renal failure. And patient may be bleeding from the various side due to disturbed bleeding tendency. And if we see the following sign and symptoms in the patient coming with the major complaint of oligouria and urea, so we can make a provisional diagnosis of acute renal failure, and to confirm our diagnosis, we perform the investigations, and these investigations include urine examination. So, in case of acute renal failure, urine examination may show RBCs, pus cells, and protein urea depending upon the underlying cause. And if we perform RFTs, then the blood urea and the serum creatinine will be raised, and serum potassium may be raised, and there is a metabolic acidosis, which would be demonstrated as pH will be low and bicarbonate is low, and also the partial carbon dioxide is low. And the ultrasound in this case will demonstrate the size of kidney. In case of acute renal failure, it is usually normal or enlarged. And if there is a obstructive uropathy, as we discussed in the causes, that acute renal failure can be caused due to the post-renal causes, and which includes the obstructive uropathy. So in that case, there will be hydronephrosis, and stone may be visible on ultrasound. Uh, and along with that, plain X-ray abdomen and pelvis will also show the radiopaque stone if any of them present. And patient, if we talk about the features of conditions causing acute renal failure, so I would like to discuss that patient may have features of hypovolemia, septicemia, and cardiogenic shock in pre-renal causes. And the blood pressure in of the patient will be high in glomerulonephritis or malignant hypertension. And there may be history of exposure to radio contrast agents, analgesics, and nephrotoxic antibiotics, which ultimately develops the acute renal failure in the patient. And the patient may give history of black colored urine, injuries, hemolysis, and there may be features of systemic lupus erythematosus and symptoms of obstructive neuropathy, and palpable kidneys may be due to the hydronephrosis and polycystic kidney disease. And these are all are the features of conditions that cause the acute renal failure in patients. So with the help of these symptoms, signs and symptoms, and the specific features of different conditions that cause acute renal failure, and most importantly, on through the investigation, we can confirm the diagnosis of acute renal failure. Thank you.